Hi, and welcome to Dragon Bites, the paediatric podcast aimed at paediatric trainees or anyone interested in child health. I'm Asim, one of the paediatric trainees here in Wales and one of the presenters for Dragon Bites. This week we've got another one of our Paediatric Grid podcasts. So if you're interested in applying for Paediatric Pharmacology Grid posts, then this is the podcast to listen to. This week we're joined by Dr. Dan Hawcutt, who's one of the paediatric pharmacologists at Alder Hey Hospital, and James Moss, one of the current paediatric pharmacology grid trainees. In this episode, they're going to tell us all about the interview process. It'd be nice to get to know Dan a bit as well, because I've not met you before, Dan. Hello again.
Hello again, Asim.
Hi. Do you mind telling us a little bit about your medical career to date as well?
Okay, yeah, no problem at all. So I'm a little longer in the tooth. So I went to Liverpool Medical School and intercalated in pharmacology. So 94, I went to medical school, intercalated in pharmacology, and because I liked it. I don't know what it was particularly that was different about pharmacology to other subjects. I just quite enjoyed the science and the translational aspect. It wasn't basic science for basic science sake. It was basic science applied to patients. And the whole questions were around how does the patient respond to what we're doing. But I'd also enjoyed pediatrics. I was very fortunate. I got a SHO rotation in Nottingham. I went down there and couldn't work out how to do pediatrics and pharmacology, so kind of didn't bother with the pharmacology. Got my membership, did the things you have to do, got a research job in Oxford, did some work there because I kind of knew I wanted to do research and I knew I wanted to do pharmacology, but I didn't know how, and I knew I wanted to do pediatrics, and I just did random jobs. And in those days, the grid posts were the pinch point of careers. It was very hard to get grid posts, so I ended up back in Liverpool doing my grid post, and was very fortunate that after my MD, there was a NIHR lecturer post. So I think I was the first NIHR lecturer in the country, and it was in paediatric clinical pharmacology because I had the background from my basic science and some of the intercalation and the other bits to go and do it. From there, it's been sort of I'm trying to think. But things build, so you have to have a certain number of people. That there've not been very many pharmacologists in the UK, so I've not set up, but I've certainly benefited from Liverpool having very strong pharmacology and very strong paediatrics, and have managed to live in a space between the two. And now we've got a second paediatric pharmacologist here in Dr. Steve McWilliam, and we've got a training program, and we've got clinical service that we've set up in Alder Hey that looks at polypharmacy, deprescribing, and complex medications in children. And it's at the moment it feels like it was a time of growth in the specialty, so I'm feeling quite excited about it.
I mean, I can imagine. It sounds like you've been there from the very beginning, then, in terms of pediatric pharmacology as a subspecialty of its own.
I think that'll be a little generous. So the godfather, or the person who was there at the very beginning and set it up, was a man called Professor Imti Tunara, who did start off in Alder Hey, but migrated to Derby, and did very much set up the specialism, set up the training scheme for grid trainees. I'm one of his first generation of trainees who came through, and now we're benefiting from his work in terms of setting it up. But probably instead of there being one centre, there's now two training centres. We have more grid trainees in post. We are setting up spin modules. So the specialty is growing, but we are in debt to Imti really for getting the whole thing going.
Amazing. So I've got a really good idea as to how pharmacology factored in so hugely to your career. How come you wanted to tackle pharmacology from a pediatric perspective? What drew you to the pediatric aspect?
Well, I wanted to be a paediatrician. I I just like the intrinsic honesty of most children. You know, if they're healthy, they act healthy. If they're sick, they act sick. And most things get better most of the time. Um, and it appeals to my mindset, that. So I quite like pediatrics was something I wanted to do. And I think if it had been a straight fight between if I had to be a pharmacologist or I had to be a pediatrician, I think I'd be a pediatrician. Probably looking for a research angle that made me happy.
Amazing. So what is it that you find to be the most rewarding part of your job?
Ooh, um, so because the joy of academic work and the joy of being an academic pediatrician is you have a lot of hats. So I think the thing that brings me the most joy is that actually I have about 5 jobs and I get to do different things on different days. So I see a lot of my friends who I qualified for medical school with and who are, established consultants now. They're looking for ways to keep their jobs interesting. Okay, they're good at what they do. They're excellent at what they do, and they do lots of different things. But they've conquered. They've got. It's like Alexander the Great. They've conquered all the things they can conquer, and it's kind of like, what do they do next? And I'm still thinking, oh God, I've got all these things I want to do. I want to get done, and ways to make change things and make stuff better, and learn things and investigate stuff and do the research and design the training and set up the services and all those kind of stuff to build on what we're doing. And I feel kind of what makes me quite pleased that I realise that I'm still very excited about coming to work every day.
So I think it's time we moved on to the dreaded interview. So should we? Is it okay to start with yourself first this time, Dan? What can trainees do to get ready for the interview?
I suppose there's a couple of parts to that, aren't there? There's the background work that puts you in a position to be a credible candidate, and then there's the delivery on the day. We've sort of covered the former. On the day, it's an interview. We are a profession. There is, wear a suit, turn up, make sure that you have thought about the likely questions that are going to be asked. We're not here to, create some awful psychological trauma or test. We're here to find out which applicant is the most likely to be successful in our specialty because there aren't many of us, and we want to make sure that you've got the best chance of success. Part of that is, can we work with you over the next 3 years and potentially for the rest of your career? Because we are not a big group of people. You can't just disappear off into a void and we won't see you again. Can you have you? And that comes around to interview style. I'm sure there are probably courses for this. I don't know of any other thing, but when you are interviewed, answer the question that's being asked, make eye contact with the people that are doing you, enthuse about why you want to be there. None of this is specific to pharmacology, I don't think. Um, Try not to be too nervous. A certain great candidate I won't mention was very nervous and didn't speak for the first 2 minutes of the interview. And that was a
That was
concern.
me.
Luckily, he then relaxed. So, yeah, be yourself.
Amazing. James, do you have anything to add to that?
Um, I would say practice as well. So, like you're going to get someone to read over your application form. I think also get someone to do an interview practice with you. Remember that most of us wouldn't have had an interview since, ST to get into peds, and therefore we're not very practiced at interviews. So again, don't get your mate to do it. You want try and set up a proper interview panel, and most people are more than happy to help you out with this. Try and get a good night's sleep before the interview as well. So like Dan mentioned, I was very, very nervous in my interview. I didn't really speak for the first bit, and that's unlike me. I normally don't shut up. Um, so yeah, I think, everyone's going to be nervous to some extent, but you know, try your best and think that they're not there to catch you out. They just want to know, are they able to work with you essentially. I think that's the best bit. advice.
Were there any resources that you used, James, to get ready? Any books or courses or things online?
No, so I didn't use any particular courses. I did get I did have a mock interview held up for me. So in my local DGH at the time, and Glenn Cloyd, one of the consultants, kindly agreed to do a mock interview for me. And like I said, so I think that's the best preparation that you can have, really.
And did you use any? Because some people come across ways they can structure their answers to try, for common questions. Did you come across anything like that?
Yeah, it's after my grid interview I did, unfortunately. So I was actually holding mock. We done a few mock interviews in Alder Hey for grid candidates, and we actually set up a proper panel. So we had grid trainees on it, and we also had some consultants who interview for grid on there as well. And one of the things I learned from that was actually to structure your answers is using the acronym CAMP. So you can structure your answers from the clinical experience that you've had, the academic experience you've had, the management experience you've had, and then any personal experience and achievements. And actually, I thought that was a really, really good way of structuring your answers, because you could almost answer any question using that format. So that's something that and it helps to kind of solidify and clarify things in your mind a bit if you've got a structure for every question that's coming up. So yeah, I'd recommend that style of answering questions.
Amazing, thanks, James. And did you have any further thoughts on that, Dan?
No, I think James covered it really.
Amazing. Right. So I know you're both on the CSAC. So there might be a limit to how much you can tell us about this following question, but I thought it's worth asking anyway, even if you could just give us some general ideas. But what sort of questions tend to come up in the grid interview for pharmacology?
So, I mean, it's an interview to get people into a specialist training post. So you're going to want to know, why do they want this job? What have they done that makes them the person we should pick for this job? What are they good at? What are they not very good at? There really is. We're not going to be like, so when give us 3 million facts about a particular drug. That's not what we're here about. It's about understanding your motivation, what you've done to make yourself the most credible, appointable candidate you can do, and what gets you out of bed in the morning, really.
So that sounds a lot less threatening than than the kind of interviews I tend to picture when I think of this thing.
I'm aware that some grid stress specialisms do expect, and people will have had a lot of clinical immersion in before they even get to grid. Um, so they would expect people to have detailed clinical knowledge of particular scenarios. That's not our world. So that's not the way we would be seeking to set it up.
Amazing. James, I think you were about to say something then as well.
Yeah, so I was going to echo that. I think the pharmacology CSAC in general are very nice and approachable, and they they are there to make sure, to appoint a person that they want to work with and think will make a good pharmacology candidate. Remember that this is a rare specialty, and therefore at the interview they're not expecting a pediatric pharmacologist to have already turned up to the interview. That's the whole point of your training over the next 3 years. So yeah, go in prepared for the questions around pharmacology, but remember that they're not there to test your pharmacology knowledge at that stage in your career.
Right. Basically, I think that pretty much covers everything that I wanted to cover for the application interview process. Did either of you have any final words to say on either of those aspects?
Yes, one thing. We are in a very lucky position that our specialty is growing, and that the range of options within it are very broad. So it's not just about, does this medicine work? There's also side effects. There's working with people like national regulators like the MHRA. There's opening the door to potentially future careers in industry if that's what keeps you interested. So we're not. I think we're very lucky in that our specialty contains lots of career options within it. And by doing it, you're going to keep a lot of doors open that would otherwise not be available, or be very difficult to access. And I guess if you're not sure and you think, well, I quite like the sound of it, but what I really want to do is this, I don't know, some niche, come and talk to us, because we have fingers in a lot of pies, and we will have a reasonably good idea if the thing you're talking about is actually pharmacology or whether we need to direct you to somewhere else.
Amazing. Right. So essentially, the main key message from this is, if you're interested, have a chat to one of the current pediatric pharmacologists.
I think if there was a take-home message, that would be it. Yes.
Right. In that case, I just wanted to thank you both for coming on our podcast and going through the Pharmacology Grid application process with us.
Thank you very much for having us, Asim.
No worries. Thank you very much, Asim.
And a very big thanks to Dan Hawcutt and James Moss for taking time out of their day to speak to us about applying for and interviewing for Paediatric Pharmacology Grid. And good luck to any of you who are going to be applying for Grid Pharmacology this year. But for now, thank you for listening to Dragon Bites.